All right, so this is Understanding Students with ADHD by me, Tasha Bland. Okay, how many students does it affect? According to Healthline.com, 6.4 million students are diagnosed with ADHD. The average age that someone is diagnosed with ADHD is 7, with the symptoms normally appearing between ages 3 and 6. How much has the number increased by in recent years? And what is the reason for that increase? There has been a steady increase of children diagnosed with ADHD, and in the past 8 years, it has increased by 42%. APA has estimated that 5% of all children are diagnosed with ADHD, while the CDC has a higher estimation of 11% of all children are diagnosed with ADHD. So there's a big difference between the two percentages of the number of children. Some reasons for the steady increase would be the internet, medical marketing, and just more qualified professionals. The internet has introduced a fast, efficient, and easy way to look up information without having to leave your home. The easy access to research signs and symptoms have helped parents look deeper into their child to see if their child is just an active child or if they may have a disorder and what that disorder may be so that they could take it to their doctor, their physician, to see if there may be something wrong with their child and if there's something, a medication or something that can help their child. Medical marketing has become more advanced and widespread. This has increased the diagnosis of ADHD and also the amount of children that are medicated as a result. So all the infomercials or what you might hear on the radio, but usually it's TV commercials that you'll hear for a certain kind of drug or pill that you can take to help with certain ADHD symptoms. It'll list other medications that are commonly used, and then it'll say if this doesn't work for you, if this hasn't worked in the past, or if you've had trouble with this, try this drug and then consult your doctor or physician. So now it's more widely known of the different medication choices as well. And lastly, more teachers, doctors, caretakers, and parents know more information and have experiences with ADHD or know of someone who has a relative with ADHD, or just everybody knows more about ADHD than they did in the past. So it rarely goes undiagnosed because someone is there thinking, well, maybe they might have this, we should look into it, or I think you should take him to the doctor to see, or it rarely goes undiagnosed. Um, While ADHD doesn't increase a person's risk for other conditions or diseases, some people, especially children, are likely to experience coexisting conditions. Now, some of these conditions would be an anxiety disorder, bipolar disorder, depression, and learning disabilities that would coexist with the already ADHD. Some behaviors and characteristics of students with ADHD would be daydreaming, squirming, fidgeting, talking too much, or talking at times that they know that they should be quiet or should not be talking. Trouble taking turns or sharing with others also. This often makes it difficult for students to learn because they're not able to focus on the lesson or assignment that the teacher has given to them, or they're not able to work on it for extended periods of time because their focus is everywhere else. Um, or else they're just considered to be disruptive in the classroom. So they're either sent out into the hallway or sent to the principal's office or sent to maybe a special education room or a paraprofessional room or sent to the library with a paraprofessional, but they're not in the class learning the assignment with their peers or with their other students like they should be because they have so much going on and they can't keep their focus. Not all students with ADHD demonstrate the same characteristics. According to CDC, there are three types of ADHD. predominantly inattentive presentation, which is when it's hard to organize or finish a task. It's hard to pay attention to details and follow instructions or conversations very well. Next is going to be predominantly hyperactive, impulsive presentation. This is when the student fidgets and talks a lot. It is difficult for them to sit still for long, and they are restless and they have problems with their impulsivity. And then lastly is the combined presentation, which is when the symptoms of the other two mentioned above are equally present, or there's a combination of both present, so it can't just be classified as one of the two listed above. It needs to be combined presentation. The symptoms may change over time, and the presentation over time will change as well along with the symptoms. They may start out with predominantly inattentive presentation, and then as they age from 3rd grade to 5th grade, their symptoms change, and it's no longer that they fidget or talk a lot, it's just that they can't finish a task or they can't pay attention, but they're no longer doing the fidgeting, so they switch which presentation they are of ADHD, and it changes with them over time. So no one child, they could stay at the same presentation, but it is very likely that they will change over time. All right, under the IDEA in 2004, ADHD is under the other health impairments category. And then on the Child Development Institute website, some intervention strategies are using a child's name in a question to gain their attention, simple, concrete instructions, just making sure that the instructions are always known and it's not hard to follow directions, it's not complex directions, it's not, well, maybe the teacher meant this time. There's no room for change or misinterpreting the directions. They're just concrete instructions. Increasing novelty of a lesson, which is if you would add movies or flashcards or group work into the assignment and into the classroom, just keeping the children's attention, which this is perfect for children no matter if they have ADHD or not. This is just keeping children wanting to learn and being excited about learning. And decreasing the length of assignments and lessons so that it's not hard to pay attention during the whole length of the assignment. If you keep the assignments short and sweet, it's not cutting your assignments and forgetting part of the assignment and then the students are learning that part. It's just making them shorter so that every student gets out of it what they still need, but it's not losing all the students' attention or making it hard for the students to focus or making it hard, like it's not making them have to constantly make an effort and constantly work at paying attention because it is such a long assignment or such a long lecture or such a long book that you're reading to them maybe, but it's just always constantly keeping their attention. And that is all I have. Thank you.